input and hearing endorsements. Do I need to start over, or are we good?
No, that's better.
I'm looking at our AV person. Start it over just from the top to make sure we're properly recorded.
I'm sorry.
Okay, I apologize if this is a repeat, but just for the interest of those monitoring the recording, the Office of the Board of Lake County Commissioners, 105 Main Street, Painesville, Ohio. Let's see, this would be for HUD Fiscal Year 2022, the second public hearing, Cdbg Home, proposed projects, and 5-year consolidated plan. This hearing is being called to order by myself, the President of the Board of Lake County Commissioners, John Hamercheck. This hearing is being held in accordance with HUD guidance on the development and submission of the consolidated plan, annual action plan, citizen participation, 24 CFR 91, for the primary purpose of obtaining public input and hearing endorsements and or objections to the proposed CDBG and home proposed projects and activities funding levels for fiscal year 2022 and for the 5-year consolidated plan for fiscal years 2022 through 2026. The public hearing will be recorded. Lake County CDBG and home federal grants programs proposed projects for fiscal 2022 were publicly advertised on June 27, 2022. Staff at the Lake County Planning and Community Development Office are available to field questions and comments on the proposed HUD fiscal year 22 projects and strategic implementation of the consolidated plan and the fiscal year 2022 annual action plan. And this is where I turn things over to Rhea Benton, our Community Development Block Grant Program Coordinator. So Rhea, you're up.
Thank you, Commissioner. For fiscal year 2022, Lake County received $1,375,761 in CDBG funding, which is about level funding from the previous year. We injected program income and prior year project funds to make the total funds available $1,825,761. The total amount was allocated to projects and programs that were listed in the June 27th public notice. We are within the public comment period, and we're welcoming any written or verbal public comments through July 29th. We've received 3 written comments so far. In addition to the annual plan, we are working on the 5-year consolidated plan. It is available for the public to view on our website, lakecountyohio.gov. Click on Planning and Community Development. And I would like to turn it over to Marion Norman to speak further on the development of our consolidated plan.
Very good. Thank you, ma'am. Marion?
Yes, hi. Thank you, Commissioner. Thanks, Rhea. The consolidated plan is something we do.
Oh, on microphone, please.
Thank you. We get out of the habit.
Yeah, there you go.
Okay.
There you go. Thank you, ma'am.
HUD has us do this consolidated plan once every 5 years. They do provide data prompts and a template for us to fill in. That is already posted on our Planning and Community Development part of the website. It goes into detail on housing needs. Housing is HUD's first name, so that just makes sense. And we've also developed a survey similar to the survey we had 5 years ago that we need input from you, the community. Whether you're a resident, whether you work here, public officials, employer, let us know what you think. Survey will take about 12 to 15 minutes is what it has been running. We just did an email blast out to libraries, superintendents, public officials in each and every town and across this fine land. So that's it about the consolidated plan. The home program, we're pretty much at level funding. We do have around $500,000. We do have a almost annual injection of program income from a former home-funded project called the Wesley Village, which is a senior apartment complex here in Painesville. So that bumps us up and gives us a little bit more money to spend on the development and preservation of affordable housing for low-income households. That's in a nutshell. Thank you, sir.
Very good. Rita, anything further?
No, Commissioner.
Thank you, ma'am. Okay. Thank you. Moving on, audience members wishing to comment on the proposed CDBG and home projects are invited to speak at this time, or an agent may speak on their behalf after stating their names and address in full in a clear and distinct voice for the record. The board requests each person to speak only once unless adding a statement for the record that has not previously been made. So with that, if there's anyone from the audience wishing to address us, now's your time. Yes, ma'am, please. Thank you.
Hello, my name is Courtney Gravens. I'm a nurse practitioner and the medical director over at the Lake County Free Clinic. Our address is 125 East Erie Street, Painesville. And I am speaking on behalf of Marty Hiller, our director. I am requesting reconsideration of Lake County Free Clinic's application for Cdbg support. I certainly would not question the value of the organization's recommended for support. However, overlooking LCFC, who provides access to basic primary health care for the uninsured and underinsured, not only seems unwise for the health of our community, but also sends a message about the value Lake County places on the health of its residents. The needs in Lake County are clear. More than 17,000 individuals in our county lack health insurance. At least that many more have some coverage, but the copays and deductibles for a basic medical problem become budget busters. Our county has a very low rate of primary care physicians for the population, 44 per 100,000, with a state average of almost 80 per 100,000 total. Data shows this is getting worse in Lake County, and basic access is a challenge. Our county has many service and agricultural industries who do not often offer affordable health insurance for their employees. We see evidence of this daily, given that nearly 80% of our working age patients are employed, often in cobbled together part-time jobs to make ends meet. More than half of our patients have a chronic condition. Addressing concerns early in a diagnosis results in interventions far less costly than the conditions when they're ignored or until they become more costly and end up in the emergency room. It is important to remember that Lake County Free Clinic services impact a patient's entire family. A healthy patient can contribute to the household as a breadwinner, caretaker, or both. A healthy patient is also part of a healthy workforce. Employers can operate at full capacity, which benefits the entire community. The support LCFC has received from Cdbg has been sporadic. 2 years ago, we received modest support, yet nothing the previous year, and now nothing for the 2 subsequent years. This despite the fact that the demand for our services is increased annually. In response, LCFC has embarked on a campaign to find new expanded quarters. We anticipate opening our new clinic later this fall, with more than double the treatment space available to serve prospective patients. However, to increase capacity, we must have local support. We are a grateful recipient of an allocation from Lake County United Way. Compassionate local physicians, nurse practitioners, physicians' assistants have been the providers for more than 42% of visits in the last 18 months. In that same period, our volunteers who all live in Lake County have given the equivalent of more than $212,000 in service value. Local foundations, businesses, and individuals support our events and make individual contributions. Fiscal year 2022, our value was recognized through a congressional appropriation of $100,000, recommended by Senator Sherrod Brown for the renovation and equipping of our new facility. We recently learned that we will be included for a 2023 appropriation of a like amount, recommended by Congressman David Joyce. In his press release, Congressman Joyce acknowledged that these appropriations were a singular source of support, unlikely to continue to be available. However, he noted the need for legislation to assure the continuation of essential services like those offered at Lake County Free Clinic. We have also recently received modest support from the City of Mentor for several years, and most recently, at the first time, a small grant from the City of Painesville. Yet we have been unable to secure regular operational support from Lake County. Despite the need for our essential services, we face our annual challenge of finding enough resources to serve those who need our care. While we address the need for increased revenues to increase our service capacity, without realizing this increase in operational support, we will be forced to turn eligible Lake County residents away. Finally, it should be noted that Lake County Free Clinic is not free to run, requiring funds to operate. We are subject to the same escalating costs that others also experience. We face significant supply chain issues, both in preparing our new facility and in assuring adequate supplies and medications for our patients. Inflation has impacted our bottom line, just as it has in every other area of our community. Despite these challenges, for the last 51 years, our price to our patients has remained the same, free. I urge your reconsideration of our application for the benefit of our patients, their families, and our community as a whole. And I just wanted to put in perspective why we ask for funds. If you are making minimum wage $13 to $15, a cost to go to another healthcare facility in our area that uses a sliding scale can be up to $300. That's for one visit. And so sometimes that's out of the pocket of someone who needs that for their gas or their groceries. Thank you.
Thank you. Very good. Anyone else wishing to address the board at this time? Ma'am.
I'm a shorty, so good morning. Judy Burr, Ecumenical Shelter Network of Lake County, 25 Freedom Road, Painesville Township. We had asked for $12,600 towards our family program, Families Moving Forward, to expand the weekend services. However, in the interim, from now till it goes to HUD, we were awarded some of that from a private foundation. So we're asking that a portion of that remain for that purpose, $3,000, and that the remaining $9,600 could be used for our new trauma-informed care initiative to train and equip all of our staff for the type of situations we're dealing with the acute mental health and chemical dependent population. And that's really it. And I wanted to also thank you for the generator, two generators that we got. We're just waiting for the gas lines to be hooked up. And this winter we will have lights, woo, and heat.
Lights and heat.
So thank you for that.
Very good. Thank you, ma'am. Yes, if you want to take that, that's fine. Thank you. And also the free clinic, if you wanted to drop off a copy as well. Thank you. Yes, ma'am.
Are you ready for the next person?
Absolutely. Come on up.
Yeah. I'm Donna Rudney from Extended Housing, and I just wanted to say thank you for your support for our projects, for our home program. So, thank you.
Oh, indeed. Thank you. Okay. Anyone else? Ma'am.
Good afternoon, everyone. My name is Tanya Taylor Draper, and I'm at 2909 Stratford Way in Willoughby Hills, Ohio. I am the councilwoman for the 2nd District in Willoughby Hills, and I'm here to kind of gain clarity as to the decision of why we were not awarded the funds for our proposed sidewalk installation project. From what I understand about this HUD grant, it's meant to do 3 things. It's meant to support economic development. It's to build stronger and more resilient neighborhoods, revitalizing neighborhoods. It's to provide suitable living conditions for the folks who live there. And if you know anything about our area, and I'm sure a lot of you don't, Commissioner Pleshnik does. He lives right around the corner from the area in question. But for the rest of you, almost 50% of the residents who live there are low income. They don't possess vehicles, so they walk everywhere. They walk in the street, they walk in the parking lots, and they're always trying to get away from cars that may be coming in their way, or buses that they're trying to swerve around them. They're on their way to grocery stores and pharmacies and laundromat, just common everyday things, and they don't have the safety of walking from their homes to these areas. I know we provided pictures in our application that actually showed elderly people with walkers trying to get across the street or trying to get through a parking lot just to get their groceries. The area, it's called Loman's Plaza. It's an old name. It's now called the Shops of Willoughby Hills. It's suffered great economic problems in the last few years. There's been several businesses that have left the area, and now it's pretty much a ghost town. There's probably 3 or 4 businesses there doing very well, but there are a lot of empty buildings. We do have a developer now who is very energetic and excited about bringing new businesses to that area. And from what I understand, that should be taking place very soon. And that's going to bring jobs, and it's going to bring goods and services that our residents need. But it also means there's going to be more cars and more traffic, and people are still going to be dodging, even more so, cars and missing residents walking. The city had requested about $450,000 and was also prepared to kind of add to the funds to get the project going. We were told, no, it's really not too much money. There have been other projects that have, we've granted, for more than what we were asking for. So it really wasn't a matter of the amount of money that we have requested. The city has not asked for funds in about 5 years. And this is the first project that we are looking for to do something with the area, the west end of the city. So again, just curious as to how your decision was reached as far as who got what. And, looking at some of the other projects that were approved, some were larger than the amount that we requested, so I guess that's not an issue. And I don't mean to undermine or devalue any other project or any other group of people, but when you have elderly people pushing wheelchairs in the street, and when you have people with their walkers trying to avoid a car, that deserves everybody's attention. And especially the Department of Housing and Urban Development. I don't think that they would like that either. So I just have another question. I don't know if you guys consider granting smaller amounts of dollars so that maybe the majority of people would get a portion. Is your decision final? I'm assuming not, since we're all here today. And there's also a project called the County ARP funding, and we were wondering if this was not in the cards for our project, if we could transfer our application to that division to maybe be considered for that funding. So I'd be interested in hearing your responses. Thank you very much for your time here today.
Thank you, ma'am. Well, if I heard you correctly, so you were saying that you thought that your $449,300 request was not the largest, and I'm looking over at RIA here. I see the next largest was $245,000, followed by $75,000, followed by $66,000, followed by $60,000.
I'm sorry, I guess I'm looking at the total, $541,700 for public facilities, so I guess that's the total.
RIA, am I quoting the numbers correctly?
Yes, I believe you're looking at the totals for each category.
Okay.
So the way we allocate funding, we kind of break it down into different categories. So the first category is public improvements, but that's for $446,000, but that's for 1, 2, 3, 4 projects. Adds up to that amount. So.
Oh, I see.
Yeah.
Okay, but still, if we were told that that was a problem, I'm sure we could have worked something out as far as reworking our numbers to accommodate that. If that was a requirement, we were told that it wasn't. The number that you were requesting wasn't an issue, so I guess that was not correct. So, but thank you guys very much.
Thank you.
Mr. President?
Sir.
Just procedurally for everyone here, no decisions are final at this point. That's the point of these public hearings, so that we can hear from everyone and continue the process through HUD and CDBG. That said, ARP, American Recovery Plan money, was mentioned, and I do want to note that there's currently a bill that has passed the State House. It's HB 377, and it's pending in the State Senate, which would give another allocation of American Recovery Plan money from the state of Ohio to the various municipalities throughout the state. In the announcement by state representatives Dan Troy, Jamie Callender, the Willoughby Hills portion, assuming this bill passes, would be $500,000. So my understanding from our county lobbyist, and we have been pushing hard for this additional funding to come to Lake County and our municipalities, is it's very likely. Nothing is a done deal until or unless it happens. But given that your request is about $450,000 and your allocation would be about $500,000, there's a very good chance you're going to be getting enough American Recovery Plan money to do this project.
Very good. Thank you. Okay, anyone else wishing to address the board? Sir?
Good afternoon. My name is Christopher Jackham. I'm a representative of the Lake County Council on Aging. I'm essentially the maintenance person. I'm just here to thank you very much for including us in the proposal. The upgrade and enhancement of the front doors for access for our elderly is going to be a significant improvement. We just want to thank everybody that's involved.
Thank you. Okay, anyone else wishing to address the board at this time? Any other takers? Sir, thank you.
Good afternoon, Commissioners. Greg Sanders, the Lakeland Foundation, address 7700 Clock Tower Drive, Kirtland, Ohio. I also want to express my heartfelt gratitude for considering our request that will allow us to make necessary improvements up to Moreland Mansion. As it was stated in the proposal, that mansion is a public treasure, but it's also an economic driver with up to 120 events occurring every year that are attended by small corporate meetings up to full-scale wedding receptions. And while many of those attendees are Lake County residents, many are not. And because of Moreland's uniqueness, we're very proud to have it as a Lake County asset that draws regionally to this community, where people don't just come to Moreland, but where they eat, where they fill their gas tanks, where they stay in hotels. And so we appreciate your investment and your partnership with the Lakeland Foundation, who is also committing some funds to do some necessary repairs. Thank you very, very much.
Thank you. All right, anyone else wishing? Yes, ma'am.
Much shorter. Hi, my name is Marie Pollard, 1563 Villa Grande Drive in Paynesville. I'm a resident of Lake County, current board member for Forbes House, and most importantly, I'm a registered voter. I come today to offer my heartfelt gratitude to the commissioners for both their past and present support of Forbes House with CDBG funding. This generosity has provided much-needed services for Lake County survivors of domestic violence. We are thankful for your continued support and advocacy for our organization. Forbes House has diligently served this community for 45 years. However, when I put my registered voter hat on, I want to express my concern with the CDBG grant money from Lake County being awarded to a shelter outside of Lake County for a service already provided by Forbes House. Lake County dollars should be utilized in our county to improve or augment services already provided by a Lake County agency. We need not duplicate services when Forbes House has capacity to meet the needs of our community. I respectfully request the commissioners reevaluate this funding awarded outside of our county for services available right here in Lake County. Thank you.
Thank you. Okay, anyone else wishing to address this board? Any other takers? All right, seeing none. Let's see. Participants wishing to comment or ask questions during this live stream meeting may do so by email they may use the address rsvpplanning@lakecountyohio.gov. Again, that'd be rsvpplanning@lakecountyohio.gov. The board will now receive any written comments on the proposed CDBG home project and/or the 5-year consolidated plan. Rhea, I believe you indicated we did have.
Yes, Commissioner, we did receive one email comment via the live stream I'd like to read.
Yes, please. Thank you.
The Fair Housing Resource Center office would like to thank the Board of Commissioners for considering our public facilities grant application. This project is very needed in our office, as this will allow Fair Housing Resource Center to provide better service to the community. Sincerely, Patricia Kidd.
Very good. Thank you. Okay. And again, that's rsvpplanning@lakecountyohio.gov. And continuing on, the Board of County Commissioners has not made a final decision on these proposed CDBG and home projects at this time, and will take into account into its consideration the public comments, both written and verbal. Additional written comments, endorsements, and/or objections may be addressed to Mr. David Radachy, R-A-D-A-C-H-Y. He is the Director of the Lake County Planning and Community Development Office at 105 Main Street, Painesville, Ohio, 44057, or by email, again at the rsvpplanning@lakecountyohio.gov, or David, D-A-V-I-D, Radachy, R-A-D-A-C-H-Y, @lakecountyohio.gov until 4 p.m. on Friday, July 29th, 2022. And if there's nothing further to come before this board at this time, I will entertain a motion to adjourn same.
So moved. Second.
And all in favor?
Aye.
Aye. There we go. This meeting stands adjourned. Thank you for joining us today.
Yes.